There is a particular trap that many intelligent and self-aware people fall into, and it is all the more effective because it disguises itself as a virtue. The trap is this: the more carefully you watch yourself, the less naturally you function. The more you analyze your own performance, monitor your own feelings, and evaluate your own progress, the more self-conscious and labored everything becomes. The observer interferes with the observed. And the harder you try to get it right by intensifying the observation, the worse it tends to get. Viktor Frankl had a name for this pattern: hyperreflection. And he developed a therapeutic technique specifically designed to address it: dereflection. Hyperreflection is excessive, compulsive self-focus, a state in which the attention is turned so relentlessly inward that genuine engagement with the world becomes difficult or impossible. It appears in many forms. The person who monitors their own anxiety so closely that the monitoring itself becomes anxious. The speaker who is so focused on how they are coming across that they lose track of what they are saying. The person lying awake watching their own sleeplessness and thereby deepening it. The patient in sexual difficulty who is so preoccupied with their own performance that the natural spontaneity required for that performance has been entirely replaced by observation and judgment. Frankl was particularly interested in how hyperreflection operated in what he called the sexual domain. He worked with many patients experiencing sexual dysfunction, and he noticed a consistent pattern. The dysfunction was not primarily physical or even psychological in the ordinary sense. It was a consequence of too much attention being directed at the experience itself. The person wanted to feel pleasure and monitored whether they were feeling it. They wanted to perform well and watched whether they were performing well. The watching killed the doing. The intention to achieve the experience prevented the experience from occurring naturally. His response was dereflection, a deliberate redirection of attention away from the self and toward the other person, toward what the other person needs, what the situation calls for, what is genuinely happening in the encounter beyond the narrow aperture of self-evaluation. The self that is genuinely attending to another person is not simultaneously monitoring its own performance. The two activities are incompatible. And when the monitoring stops, the natural process often reasserts itself. Dereflection is not the same as suppression or distraction. It does not tell the person to stop thinking about themselves by pure willpower, an instruction that reliably produces more thinking about oneself, for the same reason that trying not to think about pink elephants fails. Instead, it works by providing the attention with something better to go to. A person who is genuinely fascinated by another person, genuinely invested in a task, genuinely absorbed in a creative act, that person's attention has a natural object outside the self. The self-monitoring quiets not because it was suppressed but because something more interesting arrived. This connects directly to one of Frankl's central concepts, self-transcendence. For Frankl, the healthy human being is one whose attention is primarily directed outward, toward a meaning to fulfill, a person to love, a world to engage with. Hyperreflection is the pathological inversion of this, the self turned entirely inward, feeding on its own states and evaluations, growing more anxious and less capable with each revolution of the loop. Dereflection restores the natural outward orientation that hyperreflection has disrupted. The applications are broader than the clinical context Frankl primarily addressed. Many people in contemporary life suffer from a gentler but chronic form of hyperreflection, the habit of constant self-monitoring that social media, therapy culture, and personal development discourse have encouraged. We track our moods, evaluate our authenticity, assess our growth, and compare our inner states to some imagined ideal. This is not without value. But when it dominates the inner life, it becomes its own obstacle. The person becomes so busy evaluating their experience that they stop having it. Frankl's counsel is straightforward. Stop looking at yourself and look at the world. Find a task that genuinely needs doing, a person who genuinely needs your attention, a cause that genuinely warrants your energy. Give yourself to it fully enough that the internal commentary goes quiet. You will not become less self-aware through this process. You will become more genuinely present, which is a different and better thing. Subscribe to The Psychology of Viktor Frankl to explore more of his timeless ideas.